Hey everyone, and welcome back to the channel. Today, we're diving into a topic that's incredibly important but often misunderstood: heart health. Now, I know what some of you might be thinking. Heart problems? That's something for older folks, or it's all down to genetics, right? Well, while age and family history certainly play a role, they're far from the whole story. As a doctor and from conversations with my colleagues, especially heart surgeons, we've noticed a pattern. Many older patients undergoing heart surgery share certain daily habits, things they've been doing for years, often without a second thought. These habits might seem insignificant on their own: a rushed morning, a stressful reaction, a skipped checkup. But imagine a tiny stream of water slowly eroding a rock. Over time, these small, consistent actions can carve out significant damage to your cardiovascular system. The constant drip, drip, drip of these behaviors can lead to serious heart conditions down the line. It's the cumulative effect that often catches people by surprise, because the initial impact is so subtle, so easy to dismiss in our busy lives. The good news? And there's always good news when we talk about health proactively. Many of these habits are entirely within our control to change. Some can be reversed, others can be avoided altogether. Our goal today isn't to scare you, but to empower you. We want to help you spot these sneaky saboteurs, understand their impact, and equip you with the knowledge to make positive changes before it's too late. So, if you're ready to take a closer look at your daily routine and protect your heart for the long haul, you're in the right place. Let's get into it. Alright, let's kick things off with the very first meal of the day, or in some cases, the lack thereof, breakfast. It's often touted as the most important meal, and for good reason, especially when we're talking about long-term heart health. One of the common threads we see is a pattern of either skipping breakfast entirely or opting for quick, sugar-loaded options. Think about it. You've been fasting all night, your body's been repairing itself, and it's looking for quality fuel to start the day. When you skip breakfast, you're essentially running on empty, which can throw your metabolism out of whack and lead to overeating later in the day, often less healthy choices because you're ravenous. Now let's consider the alternative pitfall: the sugary breakfast. That giant bowl of frosted flakes, the Danish grabbed on the go, or the Frappuccino loaded with syrup. While these might give you an initial sugar rush, a quick burst of energy, it's followed by an inevitable crash. This roller coaster of blood sugar levels, day in and day out, puts a strain on your pancreas to produce more insulin. Over time, this can lead to insulin resistance, a precursor to type 2 diabetes, which is a major risk factor for heart disease. It also contributes to inflammation throughout the body, including your arteries. I remember a patient, let's call him Harold. Harold was in his late 60s, and for decades his breakfast was 2 sugary donuts and a large coffee with lots of sugar. He thought it was harmless, a little morning treat. But this daily habit, compounded over years, contributed significantly to his elevated triglycerides, high blood pressure, and eventually, the need for bypass surgery. He wasn't overweight in the traditional sense, but his internal systems were struggling under the load of refined sugar and lack of nutrients first thing in the morning. So, what's the fix? It's about making a conscious choice to fuel your body wisely. A heart-healthy breakfast isn't complicated. We're talking about a balanced meal that includes fiber, protein, and healthy fats. Think oatmeal with berries and nuts, scrambled eggs with whole wheat toast and avocado, or a Greek yogurt with fruit and a sprinkle of chia seeds. These options provide sustained energy, help stabilize blood sugar levels, and provide essential nutrients that support cardiovascular health. The fiber helps with satiety and can lower cholesterol. The protein keeps you full and supports muscle health, including your heart muscle. Healthy fats, like those from avocados or nuts, are anti-inflammatory and good for your arteries. Starting your day this way sets a positive tone for your eating habits throughout the rest of the day. It reduces cravings for sugary snacks and helps maintain a more stable energy level, preventing those afternoon slumps that often lead to poor food choices. Think of it as laying a strong foundation for your day. If the foundation is weak or made of poor materials, the entire structure is compromised. Your heart is working 24/7, and giving it the right fuel, especially at the start of the day, is a non-negotiable part of keeping it strong. It's not about perfection, but consistency. Even small improvements, like swapping that sugary cereal for oatmeal a few times a week, can start to make a difference. So take a moment to reflect on your morning routine. Are you rushing out the door without anything? Are you relying on a sugar hit to get you going? If so, this is a prime area where a small change can yield significant long-term benefits for your heart. It's about prioritizing your well-being from the moment you wake up, an investment that pays dividends in heart health for years to come. Moving on to our second habit, and this one is a little less tangible but just as impactful, holding in emotions and avoiding meaningful conversations. We live in a society that sometimes, unfortunately, encourages us to be strong by suppressing what we feel. Whether it's stress from work, frustrations in personal relationships, or underlying anxieties, bottling these emotions up can have a profound physiological effect on your body, particularly your heart. It's like constantly keeping a lid on a boiling pot. Eventually the pressure has to go somewhere. When you consistently suppress strong emotions, your body can remain in a state of chronic stress. This means elevated levels of stress hormones like cortisol and adrenaline. These hormones in short bursts are helpful for fight or flight situations, but when they're chronically elevated, they can lead to increased heart rate, higher blood pressure, and irregularities in your heart rhythm. Over time, this constant strain can damage your blood vessels and increase your risk of heart attacks and strokes. Think about the physical sensations you experience when you're angry or deeply anxious, but trying not to show it. That tightness in your chest, the clenched jaw, the shallow breathing. These aren't just in your head, they are real physiological responses. Avoiding meaningful conversations, especially when there's conflict or a need to express vulnerability, compounds this. It prevents resolution, fosters resentment, and keeps those stress hormones circulating at unhealthy levels. Meaningful connection and open communication are vital for emotional release and stress regulation. I've seen patients who are incredibly stoic, who pride themselves on never showing weakness, but internally, their bodies are weathering a storm. This emotional labor, the constant effort to suppress and contain, is exhausting and damaging. It's not a sign of strength to ignore your emotional state. True strength lies in acknowledging your feelings and finding healthy ways to process and express them. This might involve talking to a trusted friend, family member, therapist, or even journaling. The simple act of naming your emotions and sharing your burdens can be incredibly therapeutic. It can lower those stress hormone levels, reduce blood pressure, and improve overall well-being. It's about creating an outlet for that internal pressure rather than letting it build up and silently chip away at your cardiovascular health. Remember, your emotional health and physical health are inextricably linked. You can't neglect one without affecting the other. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Addressing this habit of emotional suppression is crucial. It's about fostering an environment, both internally and externally, where emotional honesty is valued. Consider practices like mindfulness or meditation, which can help you become more aware of your emotional state without judgment. Or perhaps it's about learning assertive communication skills to express your needs and feelings respectfully. The key is to find what works for you to ensure that emotions are processed and released, rather than internalized, where they can fester and contribute to physical ailments, including serious heart conditions. Your heart will thank you for it. Our third habit is one that many people fall into, often with the best intentions overusing pain relievers instead of treating the root causes of their pain. Whether it's chronic back pain, frequent headaches, or arthritic joints, reaching for an over-the-counter painkiller like ibuprofen or naproxen can seem like a quick and easy fix, and for occasional aches and pains they can be very helpful. However, relying on them regularly, day after day to simply mask symptoms can be a dangerous game for your heart. Many common non-steroidal anti-inflammatory drugs, or NSAIDs, can have significant cardiovascular side effects when used long-term or in high doses. They can increase blood pressure, which is a major risk factor for heart disease. They can also increase the risk of heart attack and stroke, particularly in individuals who already have underlying heart conditions or risk factors. It's a bit like silencing a fire alarm without actually checking if there's a fire. The alarm, pain, is annoying, but it's signaling a deeper problem. Let me tell you about Carl. Carl suffered from chronic knee pain due to an old sports injury. For years he managed it by taking the maximum recommended dose of an over-the-counter NSAID almost daily. He was able to continue his active lifestyle, or so he thought. What he didn't realize was that this daily habit was contributing to a gradual rise in his blood pressure. During a routine checkup, which he'd thankfully attended, his doctor noted the consistently high readings and, after some investigation, linked it partly to his painkiller usage. The issue here is that the pain relievers were merely covering up the symptoms, allowing Carl to push through, but they weren't addressing the underlying inflammation and joint damage in his knee. More importantly, they were creating a new, silent problem for his heart. This is a common scenario. People tolerate the side effects or are unaware of them, focusing only on the pain relief. But your body keeps score, and your cardiovascular system can bear the brunt of this chemical load. The alternative, and the healthier approach, is to work with your healthcare provider to identify and address the root cause of your chronic pain. This might involve physical therapy, targeted exercises, weight management, dietary changes to reduce inflammation, like cutting down on processed foods, or other non-pharmacological pain management techniques like acupuncture or mindfulness. It's about finding sustainable solutions rather than temporary fixes that carry hidden risks. Of course, there are situations where pain medication is necessary and appropriate, but this should always be under the guidance of a doctor, especially for long-term use. They can help you weigh the benefits against the risks and explore safer alternatives or combination therapies. The goal isn't to endure pain, but to manage it in a way that supports your overall health, including your heart health, rather than undermining it. So if you find yourself reaching for that bottle of pain relievers more often than not, it's time to pause and ask why. What is your body trying to tell you? Instead of just silencing the messenger, work to understand the message. This proactive approach can not only alleviate your pain more effectively in the long run, but also protect your heart from the unintended consequences of chronic painkiller use. It's about mending, not just masking. Let's delve into our fourth habit, which circles back to nutrition, but focuses specifically on when you eat. Irregular eating patterns, including skipping meals erratically, and particularly the habit of eating large meals late at night. We've touched on breakfast, but the overall rhythm of your food intake plays a significant role in metabolic health, which is intrinsically linked to your heart. Your body has an internal clock, a circadian rhythm, that governs many physiological processes, including digestion and metabolism. Eating out of sync with this rhythm can throw things off balance. Skipping meals, whether it's breakfast as we discussed, or lunch because you're too busy, can lead to extreme hunger later on. This often results in overeating at the next meal and making poorer food choices, opting for calorie-dense, nutrient-poor convenience foods because you're desperate for energy. This pattern of feast and famine can lead to fluctuations in blood sugar and insulin levels, putting stress on your metabolic system. Consistent meal timing, on the other hand, helps regulate these processes more effectively. The real kicker for many, though, is the habit of eating large meals, especially those high in fats and refined carbohydrates late in the evening, close to bedtime. When you eat a heavy meal and then go to sleep, your digestive system is working overtime when it should be resting. This can lead to issues like acid reflux and poor sleep quality, both of which have indirect negative effects on heart health. Poor sleep, for instance, is linked to increased blood pressure and inflammation. More directly, eating late at night can negatively impact your cardiometabolic markers. Studies have shown that late-night eaters may have higher levels of triglycerides, blood sugar, and insulin, even if their total daily caloric intake is the same as someone who eats earlier. Your body's ability to metabolize glucose and fat is generally less efficient in the evening. Consistently challenging it with large food loads can contribute to weight gain, particularly abdominal obesity, which is a strong risk factor for heart disease. Think of your metabolism like a factory. It's most efficient during its prime operating hours, daytime for most of us. Trying to run a full production schedule, digesting a large meal during the night shift, when the machinery is supposed to be powering down for maintenance, leads to inefficiencies and byproducts that can be harmful in the long run. This isn't about being rigidly dogmatic with meal times, but about establishing a general pattern that respects your body's natural rhythms. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Shifting your eating window earlier in the day, or at least ensuring your last large meal is a few hours before bed, can make a significant difference. Aim for a lighter dinner if you must eat later, and focus on easily digestible foods. Prioritize a consistent eating schedule as much as possible. This doesn't mean you can never enjoy a late dinner out, but it's about the prevailing pattern. By being mindful of not just what you eat but when you eat it, you can better support your body's metabolic processes and in turn, protect your heart from the strain of poorly timed fueling. Habit number 5 is one that has become increasingly prevalent in our modern, technology-driven world, staying sedentary for too long. Many of us have jobs that require us to sit at a desk for 8 hours or more a day, and then we come home and sit on the couch to relax. This prolonged inactivity, even if you squeeze in a 30-minute workout, can be detrimental to your heart health. It's often referred to as sitting disease, and it's a silent threat that many underestimate. When you sit for extended periods, your body's metabolic processes slow down significantly. Your circulation decreases, your body becomes less sensitive to insulin, which increases the risk of type 2 diabetes, and your levels of beneficial HDL cholesterol can drop, while harmful triglycerides may rise. This creates an environment ripe for the development of atherosclerosis, the buildup of plaque in your arteries, which is the hallmark of most heart disease. Your muscles, including your heart, are designed for movement. I recall Frank, a software developer in his early 50s. He was diligent about his annual checkups and even managed a couple of gym sessions a week. However, his job involved sitting for 10 to 12 hours a day, often without breaks. Despite his efforts at the gym, he started developing high blood pressure and prediabetes. His doctor pointed out that his prolonged sedentary time at work was largely negating the benefits of his workouts. The weekend warrior approach isn't enough to counteract hours upon hours of stillness. Think about it. Our ancestors were constantly moving, hunting, gathering, farming. Our bodies are not adapted to the level of inactivity that is now commonplace. Even short bursts of movement throughout the day can make a difference. The key is to break up those long periods of sitting. It's not just about the total amount of exercise you get, but also about minimizing uninterrupted sedentary time. The solution isn't necessarily to quit your desk job, but to integrate more movement into your day. Set a timer to stand up and stretch or walk around for a few minutes every hour. Consider a standing desk or a treadmill desk. Take the stairs instead of the elevator. Walk during phone calls. Have walking meetings. These small changes can add up significantly, keeping your metabolism more active and improving circulation. Regular physical activity, beyond just breaking up sedentary time, is of course crucial. Aim for at least 150 minutes of moderate intensity aerobic exercise, or 75 minutes of vigorous intensity exercise per week, as recommended by health guidelines. This could be brisk walking, jogging, cycling, swimming really, anything that gets your heart rate up. Strength training a couple of times a week is also important for overall muscle health and metabolism. But remember, Frank's story highlights that formal exercise alone might not be enough if the rest of your day is spent glued to a chair. The message here is twofold. Engage in regular, intentional exercise, and consciously reduce your overall sedentary time by incorporating more movement into your daily routines. Your heart is a muscle. It thrives on activity and weakens with prolonged stillness. Make movement a non-negotiable part of your day, every day. Our 6th habit is closely related to the emotional bottling we discussed earlier, but it deserves its own spotlight. Ignoring chronic stress and ongoing emotional pressure. While acute stress can be a motivator, chronic stress, the kind that grinds on day after day, week after week, acts like a slow poison to your cardiovascular system. This isn't just about big, traumatic events. It's often the cumulative effect of daily hassles, work pressure, financial worries, or relationship strains that takes the biggest toll. When you're chronically stressed, your body is in a perpetual state of high alert. As we mentioned, this means a constant release of stress hormones like cortisol and adrenaline. These hormones can directly damage your heart and blood vessels over time. Cortisol, for instance, can lead to increased blood pressure, elevated blood sugar, and the accumulation of dangerous visceral fat around your organs, all major risk factors for heart disease. Adrenaline can cause your heart to beat faster and harder, putting unnecessary strain on it. Moreover, chronic stress often leads to unhealthy coping mechanisms. People under constant pressure might turn to smoking, overeating unhealthy comfort foods, excessive alcohol consumption, or neglecting exercise, all of which are independent risk factors for heart problems. So, stress has both a direct physiological impact and an indirect behavioral impact on your heart health. It's a double whammy. Think of your body like a car engine that's constantly being redlined. It can handle short bursts of high RPMs, but if you keep it there continuously, things will start to break down. your heart and vascular system are no different. Ignoring the warning signs of chronic stress like persistent fatigue, irritability, sleep problems, headaches, or changes in appetite is like ignoring the check engine light in your car. Sooner or later, you're likely to face a more serious breakdown. It's crucial to develop healthy stress management techniques and make them a regular part of your life, not just something you turn to when you're already overwhelmed. This could include practices like regular physical activity, a great stress buster, mindfulness meditation, yoga, deep breathing exercises, spending time in nature, or engaging in hobbies that you find relaxing and enjoyable. It's about finding what recharges you and making time for it. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sometimes managing stress also involves making bigger life changes, like setting better boundaries at work, addressing problematic relationships, or seeking professional help from a therapist or counselor if stress feels unmanageable. Don't underestimate the power of a good support system either. Talking about your stressors with trusted friends or family can provide relief and perspective. The key is to acknowledge that chronic stress is a serious health threat and to take proactive steps to manage it. Your heart isn't designed to withstand a constant barrage of stress hormones. Protecting it means actively working to cultivate a state of greater calm and resilience in your daily life. Finally, we arrive at our 7th habit, and it's a surprisingly common one: going years without checking your heart health, essentially playing the ostrich and burying your head in the sand. Many people avoid doctors' visits, especially preventive checkups, out of fear of what they might find or because they feel perfectly fine and don't see the need. However, many serious heart conditions like high blood pressure, high cholesterol, and even early-stage coronary artery disease can develop silently without any obvious symptoms in their initial stages. Regular heart health checkups are your first line of defense. These visits allow your doctor to monitor key indicators like your blood pressure, cholesterol levels, including LDL, HDL, and triglycerides, blood sugar, and body mass index. They can also assess your individual risk factors based on your family history, lifestyle, and other medical conditions. This information is vital for catching potential problems early, when they are often much easier to manage or even reverse. Consider George. George was in his late 50s and prided himself on his active lifestyle. He felt great and hadn't seen a doctor for a routine checkup in over a decade. He figured, if it ain't broke, don't fix it. Unfortunately, during a company health screening, he was found to have significantly high blood pressure and borderline high cholesterol. He was completely asymptomatic. Had he continued to avoid checkups, these silent conditions could have progressed to a heart attack or stroke without warning. The "I feel fine" mentality can be dangerous when it comes to heart health. By the time symptoms like chest pain, shortness of breath, or palpitations appear, the underlying disease process may already be quite advanced. Preventive care is all about identifying and mitigating risks before they lead to a clinical event. It's about being proactive rather than reactive. Your doctor can provide personalized advice on diet, exercise, and other lifestyle modifications based on your specific risk profile. Depending on your age and risk factors, your doctor might also recommend specific screening tests, such as an electrocardiogram to check your heart's electrical activity, or in some cases, stress tests or imaging studies. These tools can provide a deeper insight into your heart's function and structure. Avoiding these opportunities for early detection is like driving a car without ever checking the oil or tire pressure. You might get away with it for a while, but eventually, you're risking a major breakdown. Don't let fear or complacency keep you from essential preventive care. Knowledge is power. Knowing your numbers, your blood pressure, your cholesterol, your blood sugar, empowers you to take control of your heart health. If everything is normal, that's fantastic reassurance. If something is slightly off, you have the opportunity to make changes early and prevent more serious complications down the road. So, if it's been a while since your last checkup, please make that appointment. It's one of the most important investments you can make in your long-term health and well-being. Think of it as routine maintenance for the most important muscle in your body. Early detection and intervention can genuinely be life-saving. Don't wait for a problem to announce itself. Go looking for ways to keep your heart strong and healthy for years to come. So, there you have it. 7 daily habits that might seem small on their own, but can quietly and significantly damage your heart over time. From the way you start your day to how you handle stress and whether you prioritize preventive care, these everyday choices accumulate, shaping your long-term cardiovascular health. It's often the things we do consistently, without much thought, that have the most profound impact, for better or for worse. But the key takeaway here isn't to feel overwhelmed or guilty. It's to feel empowered. It's never too late to make positive changes. Whether you recognize one of these habits in your own life or several, the power to shift course is in your hands. Start small, pick one area to focus on, and build momentum from there. Every healthy choice you make is a step towards a stronger, healthier heart. Remember, your health journey is a marathon, not a sprint, and every bit of progress counts. We'd love to hear from you. Which of these habits resonated most with you, or is there one you're planning to work on? Share your thoughts and experiences in the comments below. Your journey might inspire someone else. And if you found this video helpful, please give it a thumbs up. Subscribe to the channel for more content like this, and share it with anyone you think might benefit. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.